Good morning, viewers. Welcome to another episode of Monitor Your Health by Dr. Femi Ogunremi. Thank you for always being there for us. This program primarily is for us to educate the public on contemporary health issues in Nigeria. Today, we have in-house a spinal surgeon, Dr. Kau. Dr. Kau, you're welcome to the program.
Thank you very much, Dr. Femi. My name is Dr. Kau. I'm a spine surgeon with National Orthopedics Hospital, Dala Kano, and my area of specialization is orthopedic spinal surgery.
Thank you so much. So we want to learn all about, the burden of spinal injury in Nigeria. I know that a lot of us do not know what service is actually available locally. A lot of the time we have issues and the next thing we think about is we're going abroad. It's important for us to know that there are services that we are able to actually handle effectively in this country. And there are great doctors who are doing great things around the country. We're not here to advertise, but we're here to let people know that there are things that we can actually handle in this country. You're very much welcome, Dr. Kau. So we talk about spinal surgery. How bad or what is the burden of this in this country actually?
But I think we should start from the basics. Over the last few years in Nigeria, let's say about 10, 20 years ago, people begin to document properly the issue of spinal cord injury in Nigeria. It's like a very difficult part of medicine because patients with spinal cord injury, it's a big thing. It sounds very small, but for a person with spinal cord injury, it's a real issue to deal with. First and foremost, a human body is made up of a communication system between his own body and the environment. And even within his own body, it's like a big computer network where you have extranet and intranet. The extranet, the body regulates what it perceives from outside. And the body within itself tries to organize this information to propel human body to relate to its environment. So we have a brain as the CPU of the body that generally organizes all the information. Then you have the nerves from different parts of the body that picks the information from the external world and process it by sending it through the body, through the neurons, through the spinal cord, and into the brain. And while the brain processes it, it sends the same information and relay it out there. In the spinal cord injury, which can be at the level of the neck, the back, these are the two major parts. Once there is a damage to any part of this structure, the information from the brain cannot go through where the damage is. So if there's a damage in the neck, that means the head is alive. It can process information, but it cannot send it through the neck to the hand, to the chest, to the back, to the leg. So practically, if there's a damage to the neck, what the patient present or the person present with is an ability to use all the limbs and inability to use other structures around the place. Patient will present with problems like inability to move, difficulty breathing, inability to be able to pass urine on its own, inability to be able to pass feces on its own. So when I have a situation where a patient is like there's cognitive function, but inability to relate to the environment is completely lost. Now, once a patient presents with this problem, before in Nigeria, we didn't have a lot of people in this area of specialization. So mostly they leave them on bed, and within months, the patient is already late. So some even present very badly. They don't even get out of the accident scene. So the problem is multidimensional. One, what are the major causes of this spinal cord injury in Nigeria? The major causes is still road traffic injury, fall, assaults, and other miscellaneous problems. But the more we develop as a nation, the more people try to communicate on road, because our major source of communicating in Nigeria, just like the way our body communicates, we communicate with other part of, with other human beings. So that means people who live in Lagos want to access people who live in Ibadan. They want to access people who live in Kano. They want to access every part of Nigeria. And then they have to go through Nigerian roads. One, we have bad road system, we have bad road culture, and we have bad healthcare system that can promptly address accidents whenever it occurs. So we're dealing with a multifactorial problems where once we begin to identify it over the last few years, government is making concerted effort to address the problem. During Babangida era, one of the problems Babangida identified, Major General Babangida, president at that time, through Wole Soyinka, they brought out road safety in order to minimize the incidence of road traffic injury. Now, because of that, the ability to manage people on the road improved. We begin to have less accidents. We begin to have more people getting to hospital on time, and we begin to get these people in the hospital early enough. Now, because we get them early enough into the hospital, now we have to develop a healthcare system that can cater for this set of people. Now, young people begin to see these problems. A lot of young Nigerians start living abroad to learn how to manage patients like this. By the time I was doing training in Bobi, we had spinal cord patients, injured patients in the ward for 23, 22 years. They've been living in a hospital for all their lives, best part of their life. And the services was essentially to just keep them alive. And that's what we were doing at that time. Now, people like Dr. Kabiru Abubakar, people like Dr. Halimi, who are medical director now, went out of Nigeria, begin to study these problems. And they came back with other Nigerians who have been abroad for many years. And then they started institutional management of these patients using sophisticated equipment, which are readily available now in Nigeria and in many centers. We have 3 basic centers in Nigeria that can manage patients with spinal cord injury. National Orthopedic Center in Kano, National Orthopedic Center in Lagos, and the one in Enugu. And almost all the teaching hospitals in Nigeria now have consultant spine surgeon or a neurosurgeon who is adept in managing patients with this type of problem. Now, at that level, that's basically where we are now, to be able to primarily manage patients with spinal cord injury. But it doesn't end there for patients with a spinal cord injury. You now have a situation where surgeons can operate them, keep them alive, but we do not have rehabilitation center to move these patients to. So this is where we are now in Nigeria. We can primarily fix and provide spinal surgery for patients with all this problem. But once we finish operating these patients, where do we move the patients to? To the community or to a rehabilitation center? So this is where we are now at the level of spinal cord management in Nigeria.
Right. Thank you so much for that update. Now, a couple of questions actually. So we talked about, the commonest cause of spinal cord injury. We talked about trauma, high velocity injury, accident, and things like that. So how, in terms of the patient that you see at your center, where do you think we are now as to, I know, a few times I've been on the road in Lagos and you see people have accidents and the way people rush to them, they pick them, they carry them. It just worries me because I know, do we have enough, community enlightenment on things that needs to be done primarily? Because a lot of results that you're getting from your end, I think it will hinge on what is being done before the patient is taken to you.
Yeah, we have a country where the social engineers are busy on television talking. But practically what they say is actually not getting down to the grassroots. A typical example, our educational system has completely missed the point. We're way behind in our educational system. For example, when you go to a more serious country, every young people growing up should learn basic way of helping people when there's an emergency. In Nigerian, you have HOTS or MUB when there's an accident. They see patients because of empathy, Nigerian behavior.
Hello?
They rush there and drag people
we're
out
losing
of,
you there.
you know? So there is nobody coordinating the effort.
We lost you for about a few seconds.
Oh, can you hear me now?
Yes.
You know, what I'm trying to say is we have a country where there is no social, we have social engineers on television, but we do not have social engineer at community level. Now, when there's an accident, because we have a school system in Nigeria that is not educating our young people on basic life support system. How do you help people at the scene of accidents? What do you do? What information do you pass to people? How do you get the expert to be involved? We don't have all these things. So when there's an accident, what you see are hearts of people with empathy getting to the scene of accident and drag people out of cars, drag people out of the accident, and giving secondary injury to the patient. And in so doing, the patient who had spinal cord injury that is not complete, which can be managed properly, in the process of helping the people, they drag them out of the car and convert an incomplete injury to a complete injury. And then, mostly, because of the capacity of Federal Road Safety Commission, they do not have enough accidents to move patient from the scene of the accident. Patient with broken back is sometimes placed on carts, put in a bus or in a boot and brought to the hospital. Nobody give first aid. Nobody knows what to do. Other injuries are not managed. Patient is bleeding. Even sometimes, some of these road safety people, you expect to understand the situation. I mean, I've been a casualty officer for many years. You see road safety people bring in people and then they mix their dead body with somebody who is alive in the boot of the van. And then you have to separate, or sometimes they say, oh, all the people are dead. And then you check and discover that there's some people who are still alive. And then with possibly spinal cord injury. And then the trouble starts. Now you get them to the hospital. Most hospitals do not have emergency system, dedicated trauma team. Because there's no dedicated trauma team, patients are just either dumped on the floor, put on bed, and practically don't know what to do. If they have a trauma system, they don't have a spine support system. And so patients end up being on bed for days, and they're still looking for where the specialists are to transfer the patient to. And even if they got to transfer the patient to the specialist, either the bed is full in their own center, or the way they bring the patient into the hospital, or there's no money to manage the patients. So we're going from social problem, educated problem, management problem, governmental issues. Everything put together forms a conundrum where danger stares at the face of everybody managing this patient with spinal cord injury.
How sad it is, to be honest, because, you know, if we know the impacts of all this cause to an individual, not only an individual, that particular person that cannot, you know, that is injured now, is going to be in bed, like you said, some of them are in bed for years. That means the economic input that they had into the country is completely gone off. The people they support, then they're in trouble. And, you know, the family, the effort they have to put into helping this person on a continuous basis, who, you know, somebody who is injured now, who would then need support, ordinarily is supposed to be the one to actually support others. So I think it's a huge, it's a serious problem for us in this country. So I know there are things that we're still going to talk about, you know, the core spinal injury, but how do you think we can move forward as a nation? What are the things from your own end that you can just trickle here to just let, maybe we have somebody, one of the powers that be, who might have the heart to want to steer things. What can they do? What can we do as a nation?
You know, first and foremost, I think we have to go first to the basis. You know, for countries who are developing, one of the things they normally do is they look at where the problem is. What is the problem with our healthcare system? First and foremost. In the last few years, there have been so much issues, strike, inadequate pay, brain drain, which affect our system. But then you have a government that is bedeviled with political issue, much more that it takes their time, and the social issue is pushed to the back, is pushed backward. I'll give you a simple example of looking at it. How many patients do we have in Nigeria with spinal cord injury? There's no data. How many accidents do we have in Nigeria with concomitant spinal cord injury? No data. What happens to a spinal cord injured patients when they leave the hospital after successful treatment? No data. So if we do not have a data, how do you plan? So the first thing is to develop our data system. The second thing is to develop our awareness system, which you are doing now for us. The third part is to make people responsible to one another. A typical way of looking at it is this. This is a country where 80% of Nigerians earn less than $1 a day. Now, a typical treatment for spinal cord injury in a hospital is about between $1,000 and $3,000. Now, that means for one person with spinal cord injury, that means he needs about 3,000 days to be able to manage his problem, 3,000 working days to be able to manage his problem. That is the time he will be able to raise $3,000. Now, the whole family comes together to help the patient. Now, this is where the problem is. Information, misinformation, disinformation, and ingenious information management. Once there's a spinal cord injured patient in a hospital, the whole family comes the first day. That is the only day you might be able to get money from the family to do basic tests. What the family wants to know is, what will happen to this patient? Once you make mistake to say, well, it's a spinal cord injury, the patient may not be able to walk again. By second day, if you have 50 people visiting the first day, by second day, they will drop to about 10, 20. And then that means the source of income for the man is completely gone. Now, if you have a patient that is a male, who is the breadwinner of the family, which is $1, the wife is not working, especially in the north. Now, he has about 4 or 5 children. What you are saying practically is the education for these children is gone. The feeding is gone. The woman stays in the hospital for a very long time, trying to help the husband. And then that's a complete problem within the family. But the beauty is, in the northern part of Nigeria, or in Nigeria generally, it's not generally the nuclear family that help the family. You have the extended family coming together. But if the information is not managed properly, all the extended family abandon them and they become nuclear family. And with $1 a day, the rest assured there's no way the patient can get a good quality care. And then, give it or take it, within 2 weeks, patient is dead. And then, how many patients do we see? This is where the cross is. While I was in Abuja, in the teaching hospital in Abuja, I see an average of 2 to 3 patients a day with spinal cord injury on Nigerian Road, busy road. Now, there's the data published by the Spinal Cord Association, people with a disability in Nigeria. And they said, in 6 months, 6 to 8 months, the number of people with spinal cord injury presenting in Kano is 4,000. Within 6 months, 4,000. That is their data, not my data. Yeah. Now, if you have 4,000 people presenting in a facility that has only 20 to 40 beds, how do you manage those people? So, first and foremost, we must recognize that there's a problem. Second, we must bring people with diverse mind to come together to address the issue. 3, we need critical funding and training for people within this area of specialization. And 4, we need a community that will receive these patients and help them move on. 30, 40 years ago, Abuja was built as a modern city. In quotes, the modern city of Nigeria. 2 main components of Abuja is missing. Abuja did not build a single toilet system, public toilet system, and it is called a modern city. So if they did not remember to build a public toilet in Abuja as a modern city, how would they remember that people with disability will use road and will use facility, and they will create this type of things for them to be able to have a meaningful life? Then who is going to employ them? There is no law in Nigeria that states that, we don't have a law that states people with this type of disability can be moved from one job to the other one. For example, if he was a driver, they could move him to a table or desk job, but nothing like that existed. So then, no source of income after a while. Depression sets in. We do not have a social support system. Abroad, where you have, with a patient like that, they have continuous psychotherapists, physical therapists, nutritionists. All those are not present in our own community. So once you discharge patients, it is difficult to follow them up. The few you can follow up are the ones that are from a rich home or with good support system. But the other one are lost completely. And we never know what happens to them.
How sad. The other thing I was going to talk about, you actually talked about, you've touched it now, which is the rehab system, which is, I think is really important. So at the moment, it sounds like there's nothing in place other than family support whatsoever.
When you live with jokers, you learn to play cards. I heard that not long ago. We have a hospital system in Nigeria where they will say there are rehabilitation centers, and then you go into the rehabilitation center, you see few gym equipment, like somebody just go to Jankara Market and put some gym there. Last year, Dala built their first spinal cord injury center with rehabilitation. This is a step forward. It is a vision of the medical director and his team to say, we have this problem. We need to move on from just doing surgery, but to be able to properly manage them with a lot of doctors around them, other support staff, nutritionists, psychiatrists, psychologists. This is a step forward. Now, Kano is a very big place, but within a week or two, the system was overwhelmed, because once the information gets out there that Kano has this type of system, then every patient in Northern Nigeria is moving towards Kano for this type of care. And within a week, too, the system is completely overwhelmed. And now, if you have a government at the top who have this, social engineer, and they come in and look at what happened within a week, they could say, now we understood that this is a real problem. Now we have to decentralize this type of system. That means all these 6 geopolitical zones, we have a proper rehabilitation center, purposely built for people with this type of problems or associated problem like that. But that has not happened. You will hear it in newspaper, we're trying to build this. We have done that all our lives, but presently, nothing like that is happening. Other centers are trying to build their own rehabilitation, but I bet them, if you have 30, 40, 50 bed rehabilitation center, within a week in any state, it will be overwhelmed. Because once the patient gets to know it is available, they come in trying to get help, but then they won't get the necessary because it will be overcrowded. These are some of the things. Presently, no law. Presently, no structure. Presently, no system. Presently, nothing is on the ground for rehabilitation.
Wow, it's mind-boggling, and I think it's a huge challenge. Each time I hear things like this, it's like a heavy thing on my, on somebody's mind that is so difficult. Rehabilitation is key. After you guys have done a fantastic job, you might have done the primary, repair that you need to do. There's no how somebody will get back on their feet after they've been on the bed for like maybe 6 weeks or more, for them to start working without learning again, which is what rehabilitation is all about. And if we have this challenge that the rehabilitation is even not there, even your work is not going to show effectively as it's supposed to be. And I hope that people, the power that be in this country hear this, and they have the heart to just, a certain heart that will make them, that will prick them to say that, we really want to help these people. Because I have a kid last week when I pushed our, our advert out, somebody called me and told me about a patient who's been on the bed for like, I think 4 years or so, a young lady who was vibrant before she had, an unfortunate incident that happened to her, and she's on bed. She doesn't have the support that she needs. And probably this is a lady, maybe in her 30-something years old. She'll be in another 40 years, she'll be on bed without any support. I know that the resources are there in this country. Unfortunately, resources are not well managed. They're not distributed right. So what can we practically do within because I know you said something which I think is very important. Some patients are taken to centers where they cannot, receive the help they need. There are some other centers that might be able to help. For instance, you are there in Kano or Kaduna, yeah?
Kano.
You're in Kaduna now.
Kano.
Yeah. So you're in Kano, and then you are able to do all these surgeries and all this highfalutin. I see everything that you do. Kudos to you. And then there are people somewhere else, maybe who cannot do things that is meant to be, that you are skilled enough to do, but the patient is with them. They're supposed to be with you. And that's where the data that you talked about is very important. For us to know that we know what we have and where they are and who can tap, to this, can gain from these things, these resources. So what do you think we can do? That we can do possibly? Somebody is hearing and they think, oh, this is so messy. Everything is connected in a very tiki-taka way. How can we just nip into it and then start making things happen? What do you think?
The first part is what you have done with this program, to bring the problem to the forefront. Then the next step is for us to ask ourselves deeply, what are the problems? A typical thing in Nigerian is every issue of Nigerian is like a spider web. Everything is interdigitated and connected. So first and foremost, we can first of all reduce the burden on the number of patients presenting in a Nigerian hospital with spinal cord injury. How do we do that? First and foremost, we go into the garage and remove all the Uguguru and Paraga in all our garages. The whole of Nigerian garage, motor park, is filled with alcohol in all forms. Aloma, Okwenyi, everything, all of them are alcohol based. And these drivers always claim they have back pain and they use it to cure back pain. And so before they move their passenger, they take 2 shots so that their eyes will be clear. Now, the road safety people's job, or the police in Nigeria, should have been to get to the garage and make examples of these people who sell alcohol in the garage. 2, for every car coming out of the garage, the driver's blood should be tested, or breath with gun, so that they can determine the level of alcohol in these drivers. So the road safety people should not just be interested in chasing us around with sealed beds, trying to extort us for money. But for every road, they should have a breath analyzer and check drivers on the main road for alcohol. 2, our roads should be properly done. If it's not possible, we should have laws that say, since Nigerian road is very bad, nobody should travel on the road from 7 p.m. to another interstate, to another state after 7 o'clock, because the roads are bad. Now, once we move away from that, we will reduce the number of people presenting in the hospital with spinal cord injury or other related trauma. The other part we must go on is, from primary school level, we should teach young people how to be responsible. It's not all about book. We spend so much time putting stuff in the head of every young people. They must learn this, but how to be human being We don't teach that. How do we become human beings? To respect one another, to know how to save life when you see, to be able to communicate properly with the next person that there's a trouble here. I'll give you a very beautiful example. If you go to a police post, if there's an accident and tell police, you see them on the road and tell them, oh, there's an accident there. Mostly they won't go. But the easiest thing is to teach Nigerians that when they see the police, that they should tell the police people that 2 miles away, there's a bullion van that had an accident and millions of money are on that road pouring. And they just want to tell them, you will see the police will go there. Within 1 second, they will be on that particular and save life. That's one way to train Nigerians to be able to get these people to work. Bullion van. Then the next thing you move to is you train our police people, road safety people, advanced life support system. Yeah. It's not just for them to get there and then put hands in the pocket of people who have accidents, steal their things. But for them to be able to know how to save life. There's nothing wrong about teaching them how to set line, get fluid into the body of a patient in shock, to be able to identify these basic things before they move them to the hospital. Now, the next part is for us, consciously as a community, to have a communication system where it is easy to get an ambulance into the scene of an accident within a few minutes so that professional people can take over and move these people to the hospital. Now, since you have handed over to a professional, we know that in Garki Hospital, for example, there's a spine surgeon there, and this patient has a spinal injury. We will not take this patient to Bekele Hospital. We will take the patient to Garki Hospital. Basic information management. And at the level of a hospital, once they get there, because there's communication system between the ambulance driver and the hospital, they have time to prepare the emergency trauma system for the patients. And then we have a beautiful trauma system development where we have code system, protocol system, where people will know this is my responsibility. A doctor on duty will stay, a nurse on duty will be available, everything to save life will be available. And then we have a payment system or like insurance where every accident victim who is on the road has paid certain amount of money before he leaves garage every day on road, and then they can use that money to be able to immediately provide 24-hour service for them before they get their family to come and take over the burden. And then the next part is for us to have responsible system where somebody can make noise, somebody can kick dust, somebody can hit the pavement and say, life of every Nigerian matters. It doesn't matter if you're a Hausa man, a Yoruba man, a poor man, a rich man. A typical example, when Abuja airport was locked and everybody had to come to fly in Kaduna, you saw the number of security they put on that road to save like the big people's life. They fly helicopter for them, but once Abuja airport becomes functional, what happened? They forgot the people on that road. So these are the culture we have to fight. It's a culture where every life should matter. It doesn't matter if you're a big man or a small man. If you have an accident, you should get the best care within the first 24 hours, which is the point that injury prognosis becomes better if you get a good care. So these are some of the things I think we should look at.
Thank you so much, Dr. Kawu. We'll be rounding up, but you've really incited me personally, and I believe us as a nation with a lot of things that you actually said, and I just want to, when you talk about the communication bits, I think one thing I want to chip in from my own experience outside the country, I think, if we have a good control, a kind of a central control system, whereby people can phone into and then they have the information, because some of the ambulances, even when they get to the scene, some of them might not even know where is the best place to go. Of course, with education they should do, but we don't know whether the bed is available there or not. Because that's another thing. They can take a patient to maybe Garki Hospital. At that point in time, Garki Hospital might not even have the bed. Maybe all the bed is occupied. And then they waste the patient's time while they're waiting at the, in the ambulance, and then they say, you have to do that also. So if we have, just like you rightly said, a good data system where we know you can log we have 20 beds here for spine or even for other conditions, 20 beds here, 30 beds there. And as the beds are being ticked off, okay, there's no bed here. The next place is that, so that way it's easier for us to connect and then do not waste time, because a lot of the time is the thing. A lot of the time is the thing, because if we leave some of these patients for so long, it's the period that they stay, before they get the necessary treatment, that is an issue. And you talked about insurance, and I think that's a very, very good one. For insurance system, NHIS, is it working? Maybe not. I don't even know where we are with that. Somebody said about 5% coverage we have or something. Maybe not NHIS. And the truth is, I feel that everything in the hand of government in this country is really struggling. Everything, as far as I can see, I'm sorry if I've said the wrong thing, but this is what I see. Everything in the hand of government is struggling. So private sector needs to, needs to pull the strength together and galvanize that energy to move. Because I realize that you talked about, there are some private, a lot of private practices that is very robust here that can actually deliver things. The challenge there is one person cannot be an island. We still need, the likes of people who are knowledgeable, who have the skill like yourself and all these people scattered to be, but all of you are in the public sector. Do you understand? So we still, there's a lot for us to do in this country. And then prevention is key. Preventing it, I think if we prevent, we don't even get to the stage where we talk like this. So if people can be educated, we can have all our service providers, like maybe fire, what do they call them now? The road safety, the police, and all those ones on the road, the primary and secondary responders, if they can be skilled also enough to be able to handle this thing, to prevent the secondary injury from the primary scene of event, I think that will go a long way. I really appreciate you. Please, I know that we were running out of time. Can you give us your final submission and advice to people, to governments, and what we need to do and how that can actually help what you're doing in your hand? Thank you.
I first and foremost, I'm grateful that I'm able to talk with you. I think the first thing we should all have is compassion in our heart. Once there is no compassion in our heart, we don't see every other person as human. The government must be compassionate about the people they rule. The people at the ends of power should be compassionate about people under them. The drivers who want to take you on the road should be compassionate about himself and the people he's going to put in the car. And then the police on the road should be compassionate enough to say, on my beat today, there won't be an accident, or federal safety. On my beat today, I will make sure I can reduce accidents. And then people on the road too should say, I will drive carefully not to endanger the next person. So if the first thing we build in our life is compassion for the next person, then the world becomes a better place. But once you remove compassion in what we do, every other thing crumbles. Compassion will lead us to sit down together and say, Nigerians are dying. We have spinal cord injured people. We have people with all this kind of problem. We have to help them. That's compassion. Compassion is for government to say, it is $3,000 3,000 naira we have, and that 3,000 naira is used for the people. Not that the government released 300 naira, and then some people say, wow, this is a big opportunity for us, and they put 299 kobo in their pocket and only use 1 naira for the people that are involved. And then Nigerians too should come together. For those who are rich, which some of them are doing, you could see what happened immediately there's COVID. You see the amount of money, humongous amount of money that these private people brought together, much more than what even government can put together. And these are the kind of heart we need from Nigerians. The heart to understand the problem, the compassion to be able to deal with it, and the ability to look beyond what we can gain now and move Nigeria forward to the next. It's only by thinking of this world and how to make it a better place for all of us that this place will be a good place. Thank you very much.
Thank you so much. I really appreciate your contribution today. And to the viewers, thank you so much for always being there. Please, if you have any questions or comments, you can put it in the comment section. We're going to attend to them one after the other. And don't forget that the purpose of this platform is for us to educate you, to let you know what actually is out there that you might not be privy to see, and to support us by sharing, and also get people that might be, might benefit from this to actually reach, to be able to reach, to be able to get the glimpse of this particular session. Thank you so much. And we look forward to meeting you again maybe next week when we come with another topic that will be of benefit to you. Thank you.
You're welcome. Thank you very much.
Cheers.